I'm an OBGYN at Women's Healthcare of Norman, and today I'm going to talk about postpartum depression. Postpartum depression is a very hot topic in the media. All the Hollywood actresses like to talk about it, and it's actually very common. So I'm going to tell you a little bit about what it is and warning signs, and give you a little bit of an idea if you think something might be going on with you. So during pregnancy and after pregnancy, it is not unusual to have what we call postpartum blues. It's when we're feeling sad, frequent crying, moodiness, irritability. Those are all kind of normal. After we have a baby, our hormones, which have been sky high, basically crash about day 2 or 3, and then all of a sudden we start feeling blue. Your family will notice it, you'll notice it, but you'll notice, crying, irritability, just not really yourself. That usually lasts about a week and then it goes away. That's called postpartum blues, and it's completely normal. We all get it. What happens around a week to 2 weeks is if it doesn't get better, then we start thinking about postpartum depression. Postpartum depression is not the same as postpartum blues. With postpartum depression, we start developing decrease of appetite, inability to sleep, insomnia, or the actual reverse where we'll be always hungry eating, sleeping all the time, lack of interest in activities, don't really like our husband, don't really like our children, not involved with the baby, and you'll still also have the frequent crying and moodiness and irritability. If that's not going away and you're starting to really notice the effect on you, then that's when we start worrying about postpartum depression. A lot of times your family will pick it up before you do. They'll notice changes in you and notice, just a little bit of irritability. And that's when it's time to come talk to me or come talk to your OBGYN and see, if maybe you're developing the depression. Postpartum depression happens 13 to 20% of all pregnancies. It is completely treatable and usually goes away within the first year. It can happen at any time in your postpartum period. Sometimes it will be in the first 2 weeks, sometimes you'll be 6 to 8 months out, and all of a sudden you'll start noticing some postpartum symptoms. What do we do about it? Well, there's some preventative things that we can recommend, and then there's actually medications that we can recommend. So the first thing is, and you'll hear this in the hospital by the nurses and the doctors, get plenty of rest. The more rest you get and the more rested you are, the easier it is to cope with depression and depression symptoms. Eat healthy, eat regularly, stay active, take time out for yourself. When that baby comes, it's all 100% baby. Sometimes you need about 10% for you. So maybe, have the baby stay with dad for a while, or have your parents help you out, but take a little bit of time for yourself, maybe a hot bath, maybe you go walk around the block, but take a little bit of time for yourself. Exercise helps relieve stress and helps alleviate some of your depression. If none of those things work and it seems like it's getting worse, we do use antidepressants to help treat postpartum depression. Normally they're serotonin reuptake inhibitors. They're safe, they're effective. A lot of times you'll take them for 1 month to 3 months and just get you over the period of postpartum depression. And then by doing that, it will help curb a lot of those symptoms that you can't control. There is risks taking antidepressants with breastfeeding, but that's something that you and your doctor will talk about, or something that you'll talk about with me. We'll talk about risks versus benefits, but there are antidepressants that are safe with breastfeeding. And so if you are having, symptoms of postpartum depression, very important to talk to your physician. Now, one of the key things is everyone thinks, they hear these horror stories in the media about someone that has harmed themselves or their babies because of it. That's actually called postpartum psychosis. It's very rare. It happens 1 in a million chance, but that's when someone is starting to see things, they hear things, life becomes not normal. They start hallucinating and imagining things. If that ever happens, that is considered an emergency. Get yourself to the emergency room immediately. Otherwise, call us, we'll get you in, and it's very easy to treat, and it makes your life a lot better when you treat it. So, you know, postpartum depression, something to think about.